Health insurance has almost always been viewed with a negative undertone, and the recent assassination of United Healthcare's CEO has brought America's perception of health insurance into the limelight. There's no denying that healthcare costs have skyrocketed over the last year. National healthcare spending since 2023 has increased by 7.5%, a stark jump from the 4.6% increase between 2022 and 2023. This jump is largely due to the fact that pandemic federal funding for the healthcare sector expired and private health insurance enrollment has increased. While many are quick to place the blame, there's no single culprit for the rising prices. Due to labor shortages and high turnover, hospitals and doctors' offices are paying more for employees. Other factors include expensive advancements in medical technology, extraneous administrative expenses, rising pharmaceutical costs, and an increasingly unhealthy America. At MotivHealth, we understand that this is an industry-wide challenge. However, it's one that we're actively addressing. The Medical Cost Action Plan, or MCAPs, led by Dale Lyman and his team, are mission critical in this effort. Equally important is the responsible rate execution being managed by Russell Trujillo and his team. We're actively solving the industry-wide high cost of healthcare. This isn't about waiting for the spike to pass, it's about taking control of the situation, exactly what we are doing. We have immense confidence in this team and our ability to execute on the MotivHealth Advantage. So what exactly is the MotivHealth Advantage? MotivHealth is innovative health insurance built on savings and solutions that put our members' well-being first. At the heart of our solutions is price transparency. The healthcare industry notoriously makes it difficult to find the cost of care before you receive it. To combat this, MotivHealth has created a provider search tool accessible to members in their portals at member.motivhealth.com. Now, before scheduling an appointment, members can search for care by provider, facility, and procedure. Lists of each will show up with estimated pricing, allowing members to compare costs as they shop for care. It's important to remember that high cost does not equate to high quality. When you pay for more expensive facilities, you're often paying it for administrative costs such as marketing, not superior care. We also have a Smart Pay program, and through this program, members can simply call a personal health assistant or a PHA at 844-234-4472 before any planned procedure, and the PHA will do the cost comparison footwork for you. We're committed to finding everyone the right care at the right price. Members pay lower out-of-pocket rates when they utilize specific high-quality providers that have partnered with MotivHealth. And in fact, one member saved $20,000 on a knee replacement. How? Typical knee replacements cost $30,000 to $60,000. We have a contracted rate of $16,000. So the total savings in this case was $19,551. We also have a pharmaceutical assistance program. Pharmaceutical companies primarily make their money through patents. If a pharmaceutical company is the only one that offers a drug, they can charge consumers as much as they want, and they do. Once drugs become open source, the other drug manufacturers realize just how much the original patented company is overcharging. So they sell the exact same drug for a much lower price, and that drives up competition in the market. These lower priced drugs are generic drugs, and they are just as effective as their expensive counterparts. Purchasing generic medications whenever possible will significantly reduce your healthcare costs. MotivHealth is committed to reducing your prescription costs. If you or a dependent is taking a medication that costs $200 or more per month, including diabetic insulin, we will be able to lower or eliminate your out-of-pocket costs. Call MotivHealth's pharmacy team at 385-247-1030 to see just how much you could save. MotivHealth partners with Diathrive to provide free hospital-quality testing supplies to our members, which are delivered to members' homes monthly. The first kit arrives within 2 to 3 days, and refill orders arrive within 3 to 5 days. Visit motivhealth.com/the-diabetic-program to view our plan options and frequently asked questions. We also have health savings accounts. MotivHealth is focused on HSA-based health plans. Health savings accounts, or HSAs, have a triple tax advantage. They allow you to set aside pre-tax dollars for the future medical expenses. Their funds grow tax-free, and they can also be withdrawn tax-free for qualified medical expenses. You can invest funds tax-free. The funds in the account do not have an expiration date and are yours forever. They transfer with you from one employer to the next. By creating high deductible plans that coincide with HSAs, MotivHealth keeps members' premiums low. Economist Benjamin R. Handel found that when offered a choice between a high deductible or a low deductible health plan, most Americans obviously choose the low deductible. At first glance, low deductible sounds more appealing, right? Many people believe that the coverage on a low deductible plan kicks in sooner. However, as inviting as low deductible may sound, it's important to remember that low deductible health plans go hand in hand with high premiums. So when you pay your deductible, you're paying for health care that you actually receive, but when you pay for premiums, you're paying for what-if costs. What if I have to go to the ER? I'd better fork out a bunch of money each month in my premiums so that I'll know I'll be covered in case something happens. But how often do you actually go to the doctor? Does it really make sense to pay high premiums when you go to the doctor's office only twice a year? What if you were to pay for what you needed and kept what you didn't spend? According to the New York Times, economists have a term for a situation like this, where one option is better than the other under any circumstance. It's called dominance, and that is what we see in workplaces. The cheaper healthcare plan at every level of Medicare spending often has a higher deductible. We've got this. So in summary, MotivHealth understands how frustrating the healthcare landscape is right now. We're actively working to lower costs, promote savings, and simplify the process of finding and receiving care. Healthcare is not only vital, but also personal, and we will work with all of our members to meet their individual needs. Please learn more at motivhealth.com/Motive Magazine or call us at 844-234-4472. We're simply here for you always.